We divide breast cancer risk into kind of three categories. So there's personal risk. So what are the risk factors that you have as an individual that are unrelated to your family members or what's happened in your family history related to breast cancer? Those types of things are obviously healthy diet, limiting alcohol intake, keeping a healthy weight, particularly into menopause, and increasing physical activity. So a lot of the most common health improvement recommendations apply to reducing your overall risk for breast cancer. Familial risk is kind of the second category. So that's where we start to look at the family history. So how many women on either side of your family have been diagnosed with a breast cancer or an ovarian cancer, which ovarian cancer can also be a marker, an indicator for breast cancer risk. And then based on that, if we see two or more family members or a single family member perhaps that's had two instances of breast cancer or a breast and an ovarian cancer. So we're just starting to see something other than a single breast cancer, say in a 55-year-old relative, where we're seeing two or more family members, two or more instances of a certain type of cancer. That leads us to look at the third type of risk, which is genetic risk. And so genetic risk is when an individual inherits a specific gene alteration. Based on the presence of that genetic alteration, we may need to look at significant increased screening surveillance. So seeing that woman 2 to 4 times a year, making sure that she's getting annual mammography as well as annual breast MRI. And then there are lots of other things that possibly need to be investigated. For patients who do not have a genetic alteration, that just puts them back in that second category of familial risk. So it's not a genetic alteration that's impacting the cancer in the family, but it's just the fact that that particular family has breast cancer present. And so that does represent increased risk and very often can indicate increased need for surveillance.